All right. All right, the gates are open and people are joining in. Yes, we were able to get it to work. We're tech experts here. Thank you all for joining in to this webinar. We're just going to be waiting a couple minutes for people to join in, to filter in, because, you know, what's an ordinary day without a meeting running late? That delays your webinar, right? Seems like that's the norm. So we'll be getting started in just a handful of minutes once some people you know, have a little bit of an opportunity to join. Just a quick kind of housekeeping type of announcement, I guess. So this entire thing is going to be recorded, so don't worry about that, and we'll send it out afterwards once it's all, you know, processed and whatnot. Aside from that, there's also a Q&A button. Should be by default on the bottom of your screen, unless your Zoom looks weird, in which case it might be at the top of your screen. So, you know, definitely don't hesitate to drop any sort of questions you have for any of the panelists here. Don't ask me any questions because you don't want to hear my answers. And then towards the end of the webinar, you know, when we get to the end of it, we'll be answering those as well. Definitely as many as we have the time for. So yeah, aside from that, we're going to be taking a look at everyone's favorite subject, and definitely not at all a simple matter of healthcare, because I'm not even going to go into it, because I'm sure everyone here is a lot more knowledgeable about healthcare than I am, but it's definitely been a party for the last, seems like forever. But seems like we have, yeah, I think that's probably a good enough amount of people for us to probably get going. Another quick reminder again, this is being recorded, so send all your, so, you know, this will be sent afterwards, and any questions you have for any of the panelists, drop them in the Q&A, and we'll be getting to that at the end. So I think it's time for me to shut up and hand it over to Mary.
Thank you, Michael. And thank you everyone for joining us, and thank you so much for our incredible group of panelists, healthcare and communication experts that we have here to talk about healthcare at the halfway point of this crazy year, 2020. I am Mary Snoffer. I'm the president of Qnary. Joining us today, we have Deb Keller, president and CEO of TCS Healthcare Technologies, Dr. Hank Chaudhary, president and CEO of the Federation of State Medical Boards, Dr. Anish Mahajan, the Chief Medical Officer of Harbor UCLA Medical Center, and Katie Everett, Chief Communications Officer at Novant Health. Thank you so much again for joining us. A headline I saw recently on CNN was "Communication and Speed are Keys in a Healthcare Crisis," and another one from NPR, "Confusion Reigns Nationwide Amid Conflicting Coronavirus Rules." We here at Qnary talk a lot about the best ways for business leaders and organizations to communicate with both external and internal audiences, but it rarely feels as critical and important as it does right now in the healthcare sector. Today, all medical professionals, from doctors to hospital administrators to community healthcare workers, are being asked daily to clarify what is happening with COVID-19, how are we managing the situation, what precautions should we, the public, take, and ultimately the million-dollar question, how is this thing ever going to be resolved? The communication task has proven to be extremely challenging as the nature and scale and shape of the problem continues to shift and change. So, taking a moment, what have we learned from COVID-19 and the healthcare communication efforts thus far? Specifically, how should medical leaders face these issues and communicate both internally to their organizations and externally to the public during such an extraordinary period? And what can we do better as we continue on this arduous journey that is 2020? So, starting off with the fun icebreaker. This hasn't been the year that anyone, or at least I, was expecting in any way. In one word, how would you describe 2020? And I'll just jump in.
Unprecedented.
Surreal. Surreal.
Transformational.
Perfect. Did we get everyone? Great. So the healthcare industry has been in the center of all communication across platforms, social media, news, etc. What has been the biggest, and this is a big question, what has been the biggest communication challenge you have faced during coronavirus, both personally and professionally? And Anish, I would love to start with you.
Sure. Gosh, there have been so many challenges in communication. But I would say among the biggest challenges is, really being, as clear as we can be about what we do know and what we don't know about the risks and to contracting COVID or coronavirus. And that messaging is really hard, both outwardly to the public as well as inwardly. And, both have their unique circumstances and challenges, but really being clear, transparent, honest, and open is what we need to do. But it's very hard given the zeitgeist of misinformation and anxiety.
Thank you. And Deb, if I could turn it to you too, you had some interesting thoughts from our conversation before.
I think the biggest takeaways are where we sit for me right now is just, could kind of reiterate what our other guest just said. It's just what we don't know. And for me, my focus is really on the behavioral health, where behavioral health and medicine are really converging. And so I kind of am seeing things through that lens right now. So I see some positive things. I see obviously some challenges, and I see some dark months ahead, but we are learning a lot. We are learning a lot.
And speaking of those learnings, what have we learned at this point, at the halfway point?
I think for me that, from my view, healthcare technology was on a path. And I mean, it's been on a pretty persistent path of where we wanted to be since about 2010. And I think what 2020 has done is really just kind of shoved us forward into the future, probably somewhere between, I would say, 3 to 7 years. We were always trending toward telehealth. We were always trending or moving toward better behavioral health technologies, better communication methodologies, better home monitoring, things like that. But I do think 2020 has shoved us a bit toward in the future, a little faster than we anticipated. So we're in a little bit of a reaction mode on the tech side right now.
That's a great point. Katie, please.
Yeah, so I would chime in. Certainly the elements of crisis communication and solid communication strategy, the need for that's been reinforced, right? That's still in play. You have to be honest and transparent with the facts, flexible with the work that needs done this minute, and then you have to support your customers and community with what's important to them. And that changes based on brand and what you can offer, and sometimes that's just empathy. I would say that what I hope we learned, based on the response of the nation, is I hope we have learned that I think we should have communicated much earlier the legitimacy of, no, really, it is going to take 9 to 12 months for a vaccine, except in addition to that, or 12 to 18 months for a vaccine. And in addition, it's going to be another 9 to 12 months to distribute that vaccine. That was not popular information, and no brand wanted to go out and own that. And conversely, that allowed the message to take hold in the universe, saying it's going to be faster. And so people expected to return to their old life versus getting ramped up in their head that this was going to be a long time where masking, I hate the words new normal because it's an evolving normal based on where things are. And I think people thought that this was going to be a short term. They had stayed at home for a little while, and people didn't talk enough about the vaccine process and the distribution process. So I think some of the anger we have now is that people had an expectation that by now we would have figured it out. By now, all of the great minds who have all been working together, would have allowed us to go back to our happy lives, because we're not used to being this inconvenienced for this long, and nobody prepared the United States for that, for sure.
Yeah, such a good point, especially from the perspective of me, the general public. Absolutely. In terms of the, the spread of information, social media is obviously, I mean, it's insane what's happening right now, but I would love your thoughts on if you think social media and the spread of information on these platforms by everyone from healthcare professionals to my mom has helped or hurt the communication around this public health crisis. And I'll just let anyone who wants to jump in with that go.
Well, I'll go ahead and start, because social media, of course, it helps and it hurts to inform communities about all important topics. So I think it was really helpful in the very beginning to help normalize masking to a lot of people. It got new information out faster to large numbers of people as we learn things about COVID-19 that were always evolving. Social media is great to visually represent topics like flattening the curve, which is complicated, masking, social distancing, and social media allows us to take very serious topics and make them humorous, which isn't what you're getting, especially March, April, May on the news. And sometimes that's how people need to receive it. The dark side is that you're getting information on social media from the writer, and the writer is always biased, and anyone is a sharer of the truth as they choose to see it. And that truth doesn't have to be based on fact or science, which frustrates all of us on this call. And then people share the truth that they prefer. So the misinformation that floods to these channels so quickly, it's impossible to spread. And almost like COVID-19 itself, it's just insidious.
I think we also learned that we have millions and millions more epidemiologists than we thought we had.
Yes.
Many with no degrees.
Absolutely. And great. So kind of looking to the doctors for this next question. How should communication improve as we learn from the first half of the year? I think, the example that sticks out of my mind is the idea about masks, and how in the beginning we weren't supposed to wear the masks to save the masks for the healthcare professionals, but also there was so much talk about you don't need masks. And then I remember reading this New York Times article, and it was like, of course a mask would help. Like it is crazy that a mask would not help in the situation. And then it turned so quickly to everyone must wear them. How should healthcare professionals communicate to enact swift action moving forward?
Well, Mary, that's a great question. And thank you to Qnary for putting this together. This is timely because literally this week, there's a lot of interesting comments out there about how to manage this pandemic. But I think people need to understand, and we all need to do a better job of communicating this, that guidance changes. I was health commissioner on Long Island back in 2009 when we had the last pandemic, and trying to be consistent is one thing, but also recognizing that guidance changes as the science and the evidence changes. Sometimes I feel like I'm watching a Quentin Tarantino film, except we're all in it. And so there are more experts than ever. There are more opinions, more commentary, more politics, and more confusion. And that's a problem. And so what we need to do as healthcare professionals working with you all in communications is making sure that we do our best to filter out the junk, because there's a lot out there, especially lately. And we need to figure out how to speak in layman's terms, because sometimes the terms we use don't always translate. Mary, you mentioned your mother. Initially, remember the other phrase we used a lot was flattening the curve, which is a wonderful slogan. I tried explaining it to my parents over the phone. I could not do it. And they're, one's a lawyer and one's a high school teacher. So, trying to figure out what are we trying to achieve, and that things will change, and also avoiding scary terminology. I've heard more than one person, more than one doctor say that, well, what we're going through is unprecedented. In some ways it is, but it really isn't. Unprecedented is 1918, when we had the worst global pandemic in the history of human history in terms of one pathogen causing 50 million deaths. We've come a long way from 100 years. We have better science. We have smart people working on a vaccine. We will get a vaccine. We have smart people trying to figure this out, and this pandemic will end, as all pandemics do. So part of this is providing comfort and reassurance and helping people filter out some of the wrong information out there.
Yeah, I'll just add, a slightly different take on the communication. I have found within our own guild of physicians a fair amount of dissension about what the message should be about masks, for example, where we have, this notion of evidence-based medicine that, gosh, if there's data that proves something, then it's real. And the data has to be obtained in classic randomized controlled trial studies that get published in the best journals in the world. And of course, I believe in that. However, what I had seen in my own experience, as I talked to doctors and hospitals around the nation and here in California, there have been, a small minority, but a vocal minority of physicians say, well, there's no evidence that masks work. We don't have those studies yet, and so we don't need to say that masks should be required. And, I feel that, this is one of those moments where we all need to have some humility about what we don't know. And that includes the epidemiologists that have the PhD, and that does include the doctors that are working in the hospitals to sort of say, well, we're not really sure if this works, but it isn't something that could protect us. The data is going to come around. We're going to have the studies. But until then, we're going to speak in one voice, really, and try to ask all the staff and all the public to do this. And, I think that was a bit of a missed opportunity from within our own guild.
Yeah, I would agree with Anish. I mean, trying to be consistent is one thing, but, it's hard to be definitive, because to do this well, you have to sort of be almost a little ambiguous, and that causes even more confusion. I think everyone seems to agree wearing a mask, 6 feet apart, and washing hands are simple ways that everyone can sort of keep the pandemic and the virus away. Yes, there was some mixed messaging about some of those early on, but there's hard data. You can look up in Lancet and other publications that hopefully those aren't issues, and yet they are issues. So it requires all of us to sort of be constant reminders of what works and what doesn't work, and letting people know things will change.
Great. And yeah, I love that idea of just being open and honest that things will change, and kind of moving away from this kind of gotcha society of, if someone said something at one point, it was what we thought was the right thing. At that point, it doesn't discredit, what they're saying now. So in the spirit of taking a pause at the halfway point, are there, and Katie, I'm looking at you for this question. Are there healthcare brands, healthcare leaders that you feel have just gotten the communication right and have done a good job to this point, communicating, whether that's with an external audience or an internal audience?
So as far as brands and leaders, Anthony Fauci has been outstanding. I would say, his leadership brand has been terrific. He's been easy to understand, and he's been visible. Nationally, Johns Hopkins came out of the gate early with the data, and so they are the single source of truth for the number of cases across the world. It's on all the news feeds, and so their brand has really stood out. Although there are a lot of brands that are strong locally. So just to tout Novant Health, I'm really happy and I'm proud of the communication efforts that we've had. We are the trusted resource for our communities, and we pivot and change based on the rumors that are out there and the facts that people need. As far as brands that have not hit the mark, I'm going to say one that is odd, and I'm going to say it's the CDC, because they are the trusted resource for my organization. If you want to know where do you go for information that is accurate, it's the CDC. They're putting out great information on a regular basis. But because they were slow to react, and we mentioned this earlier today, we're waiting until we're right. And that created a vacuum. And in that vacuum, Andrew Cuomo became the nation's expert on coronavirus. And he did his news conference every day, right when people started working from home, for those that could. People who have no interest in Andrew Cuomo or what's going on in New York necessarily. I know people who watched that religiously because they felt like that's where they were getting reality information. And I think that the CDC at that time, that's when they need to stand up and do daily press conferences. I think they did that for Ebola, and we should see them as the trusted leader because they are the ones who have the information for our organization. I think they let other people take control of the message. Again, they wanted to be right, not fast, and the media outlets, they can't afford to wait, and news will be out there. And so I think that the CDC had the biggest missed opportunity to support the country and to really make their brand to the leadership role that they should own.
Such good points. I'll leave that. Does anyone else want to jump in there? Okay, hard act to follow. So moving on to the next question. So I read a headline a few months ago, and it really, I think it just scared me so badly. It's been in my mind ever since, and it was someone, some person with a lot of experience and whatnot, saying that this winter, like it was like, if you thought this was bad, wait till we get into the winter. It's going to be the darkest winter in modern times, and it just sticks with me because it seems so horrifying. But having the opportunity to be talking to you all, how do you anticipate the second half of this year going? Will it be the darkest winter of modern times?
Winter is coming. I think three things will happen. I think it will get worse. We just passed the 150,000 death mark. It is likely that we will go beyond 200,000 before the end of this calendar year. I mean, people shouldn't be shocked by that. The numbers seem to suggest that that's the trajectory we're under right now. I think the second thing that'll happen is it is likely that before the end of the year, we will have at least one vaccine globally that will be declared effective enough to be administered. Now, as someone said, it'll take some time to administer it, but already we're seeing certain countries even starting to give it. But I think that is a hopeful sign and really an indicator of how far we've come in science. Third, I think nobody's going anywhere. I haven't been on a bus, train, boat, or plane since February, and may not get on one of those until next February. We'll have to see. So we're all going to need to just hunker down and get used to these sorts of platforms to engage with people as best we can, but trying to maintain our sanity and going for walks safely and doing what we can. But we need, talking about expectations, I think those are likely.
Yeah, I'll just chime in and say I'm very concerned, and I'm very concerned about the future and the 6 to 12 to 18 months ahead of us, especially here in our country. We have yet to show the discipline necessary on the part of individuals, the public, businesses, and the government. At all levels, we have yet to show the discipline necessary to reopen safely, and it has dramatic effects, extremely deleterious effects on children, because we're not going to be able to open the schools up safely the way we are going. And it really, to me, I'm very hopeful about a vaccine as well. And as the points have been made, do we know yet if it works? And hopefully it will. But then there's the rollout, and then there's the take-up of vaccines, and that's another challenge in our country. And so I am very concerned that we need a reality check in the United States. We should not be surprised at the next wave of virus that we have seen this summer across the U.S. If we're not going to change our behavior. if we're not going to reduce our personal risks that we take in our social gatherings, if we're not going to have businesses set themselves up to ensure the social distancing and mask wearing, if we're not as a nation going to make sure that we ramp up test kit supplies and that we have a contact tracing workforce that can meet the number of new cases per day. The number of new cases per day in most jurisdictions of the US, far too high to do what's necessary to control this virus. So on a number of fronts, we are not doing what's necessary. And the next 12 months could be devastating as a result.
Yeah, if I could, I completely agree with Anish. I think there's still a lot that we can do and should do as a nation and as individuals. In fact, some of these conversations, I mean, in the beginning of this, I mean, it's almost understandable. There are going to be some slow starts, but at this point, with as many cases and as many deaths, we really shouldn't still be worrying about accessibility of masks, for example, personal protective equipment for at least healthcare workers, testing. There's some interesting guidance being issued about how to do all that well. And I scratch my head because I wonder, a lot of that could have been done a lot sooner. And so we can mobilize as a nation for a lot of things. We have done so historically. It's not clear to me and a lot of people why, for some reason, we just can't connect everything together. Maybe it has to do with coordination. Maybe it's because every city, county, and state is doing its own thing. It's a different approach than we took with the H1N1, where the CDC was much more in charge and visibly so. This is a different approach. Doesn't mean one is right or wrong, but there are some issues here.
Yeah, I'm going to hop in and say, like my other two panelists have said, very worried for a wide variety of reasons. Obviously, we won't have widespread immunity. We won't have widespread use of a vaccine. We're going to go into the cold and flu season, which then people are wondering, could it be COVID? Do I get tested? Do I not get tested? As aggressive as folks are being sometimes in public spaces, if you go in and start coughing, what's going to happen? I mean, it's a little crazy out there right now. We've got, we're looking forward to unprecedented behavioral health challenges that always escalate during, the winter holidays. And I think that's going to be unprecedented. We've got, to Katie's point, we've got a lot of misinformation. We've got to do a lot of reparation. We've got an extremely high number of people saying that if there is a vaccine, they're not going to take it. So this is tough. We're in a really tough situation. With that, I do think we do have some bright spots. I think, telehealth is working. I think the PCPs are reporting, great satisfaction with using it. Patients are liking telehealth. I think, that for the most part, the technology supporting the healthcare industry and the payer space and everything has held up probably better than we thought it could. So we have clients that we have, 300 to 500 users using our platform that immediately overnight dispatched all of those folks to working from home and spun up the technology to make that happen, which, is just, a big success story, but that's going to have to continue. And I think, it would be remiss in not calling out that we're going to have an incredibly contentious election with a pandemic in the middle of it. And I think it's ironic that both campaign slogans really have a hint, and this is Katie's space, of looking back and trying to get something back, make America great again, build back better, and there is no going back. We're never going to go back, whatever back was, but we still have time to get it right if we are willing to take up the mantle and do what we need to do. So.
Well, and of course, COVID is only one of the things happening in 2020. You're alienating a tremendous number of people if you want to look back and go back with mild progress we have made with race relations and social justice in the past few months.
Mm-hmm. Yeah, back is not the direction we should be headed.
Such a good point. Thank you. And in the interest of time, Michael's letting me know that we're having a lot of great questions coming in from the audience. So I'm going to pause with my questions. And then, Michael, if you want to start sharing some of those questions, that would be excellent.
Right. Yeah, happy to do so. So got a bunch of questions. So just going to kind of pick and choose, I guess. I have that luxury. So we have one from someone who says, where should people go to get the correct information on COVID and feel comfortable with the information we are reading or being told?
So I'll start and then others can chime in. I tell doctors and other providers that this is for some reason not well universally known. There is an expert US panel that was developed by the NIH and includes NIH, CDC, FDA. It includes the American College of Chest Physicians, American College of Emergency Physicians, and they get together almost daily to review all of the scientific literature and put that together in treatment guidelines for practicing physicians and other providers. They call it a living document. And so there's a website called COVID-19 treatmentguidelines.nih.gov, and it'll cover everything. It'll cover whether or not vitamins are helpful. It'll cover hydroxychloroquine. It'll cover remdesivir, dexamethasone, some of the interesting, sort of esoteric sort of approaches that are being tried that this expert panel has been reviewing. So that's for providers, that's what I would recommend. For the layperson, I'll defer to the communication specialist, but there are so many things out there. I think you want to find a consistent voice. Someone like Dr. Fauci has been brought up a lot. He is very careful and thoughtful in the use of his words. And he's been around a long time in advising governments and presidents, and also thoughtfully, he is an expert. He literally writes the textbook for medicine for the majority of physicians in this country. And so, but not just Dr. Fauci, there are many other good voices that are on the air that are worth looking to, especially those with a public health background who have a better sense of population health in addition to individual care.
All right. Anyone else have any thoughts on this? Anyone chime in?
I'm just gonna, God bless PCPs. Call your doctor. That's just call your doctor and ask, if recommendations are made, simply ask, what are you basing this on? Or so it's just, you've got to have that trust with your own personal physician because there's just so much noise out there.
And Deb brings up a good point. Be an informed patient. Ask questions. Don't just, take for granted whatever is recommended or advised to you. We're trying to teach, Anish knows this, we're trying to encourage this notion of not just informed consent, but patient-centered care, which involves getting involved and not just taking for granted whatever is recommended.
Mm-hmm.
Okay. Got another one here, just directly from the chat, which I think is pretty interesting, probably for more our comms people here. Do you believe that the social media outlets are causing the lack of coordination amongst people to follow the CDC guidelines?
I think social media is a megaphone. Unfortunately, it's a little bit of telephone, and I think Katie hit on this. People are looking for sources to reinforce what they already believe. And I think social media is just simply a megaphone, not a cause in and of itself. I don't think that's my thought.
Agreed. Facebook has become a news outlet, never intended to be a news outlet. And so I'm disappointed that people choose Facebook to be their source of news. And so, yeah, I do think that contributes to the fact that people get misinformation, confusing information. But I do think that if people want to find the outlets that have the right information, they are also on Facebook.
Yes.
So if people really want to look for solid information, they can follow the CDC. Choose not to do that, and they get whatever's in their feed, and good luck.
Yes.
Okay, I have a question that was specifically for Deb, but I think everyone probably has some thoughts on this. How are the tech needs of healthcare organizations shifting in this whole COVID crisis?
Um, the again, I think the technology has been set in motion. The trajectory that we have been headed toward since about 2010, the path has been laid out. Now, obviously, we've had some disruptive technology, which is always a good thing. AI is, expanding in use. I'm thrilled to see behavioral health technology and behavioral health apps being advertised on TV. I think that's wonderful. I mean, when do you ever hear behavioral health technology being discussed at all? So I think we're on this trajectory. I think the biggest challenge is the remote workforce right now, and the accelerated use of newer technologies. We're having to dispense it, utilize it, learn and enhance it in a very rapid cycle, an abnormally rapid technology cycle. So I think tech vendors are just being pushed for better, more, and faster in an unprecedented way.
And if I could, I'll mention specific to telemedicine, there certainly has been a lot of that, both on the provider side, doctors who said they would never do it are suddenly doing it, patients who said they would never do it are suddenly using it as well. We've seen that drop off a little bit in places like the Northeast because things are getting better, so that people still value in-person care, but clearly technology today has enabled a type of interaction that just wasn't possible 10 or 20 years ago. The state medical licensing boards have been helpful and flexible to respond to this by allowing the practice of medicine both in person and through telemedicine technology across state lines. We'll have to see what happens post-pandemic. There's a lot in the industry who are asking those questions, but the other thing that's happened is an interest in interstate licensure. There's an interstate medical licensure compact that's been signed into law by 29 states that have said basically if you as a physician meet 9 criteria, you can get licensed pretty much instantly. And more than 10,000 licenses have been issued through that so that people can practice care, because it's not the old-fashioned, put up a shingle and just see whoever comes to your door. It's a much more wider world, and that's good for access to care.
And you bring up a good point. Where is telehealth happening? It's interesting how security or the idea of security around telehealth is, we kind of in the need to leverage telehealth so quickly, we've kind of set security a little bit to the side. Is your doctor at home while he's doing telehealth sessions? Is he recording your session? Who's standing behind the patient? Who's overhearing? And all of those things. And I think it's kind of interesting that we've kind of put that whole discussion on ice right now. But I think it will be a discussion that we have to have.
I just want to jump in here and say that, the telehealth, some people have rightly called it sort of one of the silver linings of the COVID pandemic. Now we are forced to actually deal with it and do it. One of the things I think everyone is aware of, but just to call it out, the digital divide and access to internet bandwidth and the access to devices to actually participate in it. It's no secret that 1 in 3 Californians are on Medicaid or Medi-Cal and are low income, and their access to internet, their access to devices that we can actually do this kind of thing are extremely limited. And so, we are again looking at a situation where we are going to improve telehealth for a segment of the population of our country, but there's a whole segment of it that probably needs it more, given the burden of chronic illnesses that they have, that need those devices. They need those weigh scales at home that are Bluetooth so that we know how they're doing. They need those blood pressure monitors at home that tell the doctor what their blood pressure is so we can adjust the meds without them coming in. We don't have those yet, and we need to figure that out.
Yes,
I think that's an excellent point Anish makes, because technology is wonderful, but if you get chest pain in the middle of the night at 3 o'clock in the morning, that's not the time to power up your laptop. That's the time to call 911 and get to a hospital quickly. And sadly, and Anish knows this, and many of you know this, we've seen a lot of people afraid to go to the hospital, even with chest pain or even with a stroke.
Oh yeah,
and
we haven't talked about that.
That's right. I hope
demand. Yeah,
that's right. So access and technology is one thing. Not everyone has it. And then there's this fear factor.
Mhm. And it's funny because that, I know we're not talking about schools, but that digital divide, as you said, is we've seen that across the spectrum. We've got the same issues with, schools. It's okay, we're going to do partially remote and things like that. If you don't have the technology and we don't have the services, how do we do this well?
Right.
And again, we're being pushed on a trajectory that, we never saw coming.
All right, got a pair of questions here that'll perhaps allow all of our panelists to maybe vent a little bit. First, pretty big concepts, but one is, why do you think there's such a huge discrepancy between how Americans have reacted to the pandemic and with large amounts of skepticism and how the rest of the world has? Pretty big question.
I'll start. Someone has to. It's not an easy question. I think it's partly cultural. I mean, if you think about what makes America great, setting aside the politics, it's our ability to be incredibly creative, incredibly innovative, because we think independently. We don't take things for granted. We question everything. And that's wonderful for entrepreneurship and advancement as a nation. And I mean, look at how much we've contributed to the world. At the same time, that same sort of thinking can hold us back because we question too much sometimes and we don't know who to trust. And we want to sort of trust our instinct because our instinct over the last 200 years hasn't been too bad, more or less, on the whole, by and large. So I think that is a healthy skepticism, but it's taken to extremes when things get really out of hand, and things are getting out of hand. There are too many cases, too many people dying, and people are wondering if there's another way to address this. And that's why they're sort of going to these fringe ideas. Now, that's a sweeping statement, but it may be part of what we're seeing.
Yeah, I'm going to jump on with that and agree with everything that you said, but I'm also going to say that, the lack of leadership and the abdicating of responsibility for providing clear messaging and clear direction and consistent methods has been, I think, so destructive, so disappointing.
Yeah, and our sheer size makes it challenging as well because what New York needed in March, in North Carolina, we didn't.
Mm-hmm.
They had so many more cases, and that kind of came south. And in North Carolina, for the governor to come out and do one thing to say the entire state needed to stay at home when there were many counties who didn't have one positive case yet. And it's hard for people to understand their responsibility when their county feels immune. And they're not immune. There's certainly pockets of our country where we don't have as much. And so it is harder to say one size fits all and we're going to be okay, except if we had known, if everyone stays home, wear a mask for 6 weeks across the country, we could stop this, except I don't think people did know. And if they did, that message didn't get out. And so I think that there was a lot of, well, let each city who needs to make a decision or a county make a decision, and then the states would make a decision and it would be different. I just don't think that anyone had benchmarks on what is safe to do and not safe to do. And I'm not sure that we would know what those benchmarks should be. People want to say that it's testing. When the percent positive is under 10%, then you're good, except we are testing more and more people. And so that's not equal number. I just think that our sheer size and information keeps changing such that it is difficult, and Americans want to know 100% that this is going to work, or they don't want to be inconvenienced.
Yeah.
I'm going to add that we have as a nation have systematically underfunded public health. We spend so much money on people like me at the hospitals, on doctors and healthcare delivery, but public health has over the decades. And we were warned. We were warned by the experts in public health, and You know, it takes an event like this to wake everybody up, and now we're woken up, and hopefully in the future we'll make smarter decisions about that. You know, it makes me think of climate change. We've been warned. What are we doing about it? These are the things that, you know, we as Americans, we are amazing, but we also have to pay heed to these kind of long-term investments. And I worry that we didn't do that here in public health, and there may be other things we're not doing that in as well.
Well, thank you so much. We are just at the end by the minute. So this is a good time to close. But I so appreciate your time and your insight. I feel like I personally have a better handle of everything. At least I'm a runner. If I'm on mile 5 and not mile 23, I want to know so I can prepare accordingly. So, you know, I found this really helpful, and I know our audience did as well. Thank you again. And then for our audience, we'll be sharing this as well. So you can just listen to it over and over again. But thank you, everyone. I really appreciate the time.
Stay safe, everyone.
Thank you.